Hi, my name is Christian. I'll be your student physical therapist today. Before we get started working, I'm going to make sure I wash my hands. All right, and then I'm going to make sure, before we move around, I'm going to make sure the bed's locked. I'm going to make sure that your wheelchair is locked. All right, so to begin, I'm going to drop down the armrest or the arm guard. So first thing that we're going to do, make sure that your gown is down. We're going to expose your lower extremities. All right. So that as I saw in your charts that you're experiencing some left side weakness due to a stroke. So we'll take that into consideration throughout all of our movements today. We lift your head up for me. Good. All right, so the first thing we're going to do is shift down in bed, and then we're going to shift up in bed. So I'm going to ask you to use your arms to push into the bed. Then I want you to bring your heels up to your bottom. Good. All right. So I see that you need a little bit of assistance bringing these left side to the position that we wanted. All right, from here, I'm going to ask you to bring your bottom up, tuck your chin, and use your elbows and heels to wiggle down to the foot of the bed. Okay. All right, that's good. All right, so for scooting to the foot of the bed, notice that you need a minimum assistance. All right, next thing we're going to do is scoot up to the head of the bed. So using the same methods, we're going to push the elbows into the bed, and then push our heels as much as possible, and wiggle our butt up to the head of the bed. Okay. So whenever you're ready. Good. Right there's perfect. All right, so now we're going to work on the other side. So we're going to scoot in this direction. So for that last grade, you still needed minimum assistance to help you move to the head of the bed. All right, so now we're going to use our elbows and heels again to help wiggle you towards this right side of the bed. Okay. So whenever you're ready, bring your elbows into the bed, push through your heels, and wiggle yourself over. Perfect. All right, so from here, I'm going to ask you to lay this leg straight, lay this arm straight, and then you're going to use this left arm to reach to the side of the bed to help pull your body over, to rotate you, or to just turn you towards me. And then you're going to use this knee to lay over your body to help your lower extremity or lower body rotate towards me, okay? All right, so whenever you're ready, you can reach across. Good, reach across with this leg. Good, all right. So that rolling and scooting required minimum assistance. You can roll back. I'm gonna place up the railing. Open it. So before we get started on this side, I'm gonna put your shoes on for you. All right, so we're just putting your shoes on because after we roll to this left side, we're gonna get you into a sitting and then standing position. All right, now that we got your shoes on, I'm going to ask you to use your elbows again to push into the bed. Lift your knees up, or this right knee and then left knee up. I'm going to ask you to scoot to this left side for me the best you can. Good. All right, so that scooting to the left required minimum assistance. Now I'm going to ask you to drop this left leg down for me. Lay this left arm straight for me. Then you're going to reach with this right arm to this left side of the bed, help you rotate this right side, and then pull this right leg over. Good. So rolling required minimum assistance. Now from here, I'm going to help you as much as you need to come to a sitting position, okay? Okay. All right, so I'm going to drop your legs off and then help you with your upper body. Good. Good pushing with that hand. Awesome. How do you feel? Good. All right. So I see in your chart that your weight bearing status is as tolerated. Your weight bearing is tolerated. So whenever we get into a standing position, you're just gonna put as much weight into this left side as much as you can. Okay. Okay. All right. All right. So before we put your gate belt on, we'll make sure your feet are flat on the ground, like so. And this is just for some extra support when we're walking. Just make sure you're safe. Good. And this is going to be a little snug on you. Okay, how's that feel? Good. All right. So what we're going to do now is scoot as close to the wheelchair as possible. So you can use your hands to push you over towards the wheelchair. Good. Awesome. And can you bring your hip forward and closer to the wheelchair? Good. All right. So from this position, I'm going to ask you to lean over your toes, reach this right arm to the armrest of the chair, and then while you're looking at the armrest, I'm going to help you kind of come from a squatting position. So we're not going to stand up all the way. We're just going to squat and sit into this wheelchair, okay?
Okay.
And the brakes are locked, so you're safe, okay?
Okay.
All right, so on 3, lean over your toes, look at the wheelchair, and then we'll move, okay?
Okay.
So 1, 2, 3. Good. All right, so that transfer just required minimum assistance. So you just have a little bit of weakness there. All right, so then you were able to do about 75% of that work, so.
Okay.
I'm gonna put this arm straight down for you. Put this armrest down. All right, and then I'm gonna move you over a little bit, give you some room for walking. Let's see. There. All right, so now I'm gonna show you how to use your walker. This is a device that we use to learn, or just be more comfortable walking. So since your weight bearing is tolerated, again, we're gonna put as much weight through this left side as possible. So whenever we get up from our wheelchair, we're going to use our hands to push off of the chair, lean over our toes, come to a standing position, grab the walker, and we'll use this for support. Whenever we begin to walk, the first thing we'll do is move the walker, and then we'll move our left leg, push through our hands, and then we'll move our right leg into the walker.
Okay.
All right, so we'll give that a try. This is called a modified 3-point gait, okay?
Okay.
All right, so whenever you're ready, you can scoot to the edge of the wheelchair. All right, and you can lean over your toes and push off of the armchairs of the walker. Okay. So on 3, 1, 2, 3, lean, grab the walker. All right, so from here, we're gonna move the walker forward, move the left foot forward, push it to hands and right foot. Walker, left foot, hands, right foot. Good, perfect. All right, now we're gonna turn, so you can turn to your left foot, hands, right foot. Again, perfect. All right, now we're gonna make our way back to the bed. So a couple more steps. Great, good job. Perfect. All right, we'll start to rotate. Good. All right, now we're gonna back up to the bed until you feel it on the back of your legs, okay? Good, almost there. Good job, you feel it?
Yes.
All right, so now you're gonna reach back with your right hand. Reach back. All right, now we're gonna lean over the toes and lower our bottom slowly to the bed. Good, how do you feel?
Good.
I'm gonna move this out of the way. All right, I'm just gonna remove the gate belt for you.
Okay.
All right, and then we just use contact guard while you're doing your walking. All right, so now we're going to go back into our laying position. So I'm just going to help you down as needed since you do have some weakness on this left side, just to make sure we get back in bed safely.
Okay.
So you can lower yourself slowly with this left side, and I'll help you bring this leg up. Good. And that requires minimum assistance. I'll take your shoes off so you can get comfy in the bed.
Yes.
All right, I'm gonna leave your call light with you just in case you have an emergency or need some help. And you can just press the red button and help will be here, okay?
Okay.